I'd like to ask you a question around, so women returning to work after having children, they may face some particular challenges. What support do you think would be helpful for those who are returning to a speciality after a period off work?
Yeah, so it's really important. It's very difficult after a period of work. You feel de-skilled. Even if you aren't de-skilled, there is always a perception of de-skilling and a reduction in confidence. So it's important that we have these support to work schemes, and there are provided by the Health Education England for anyone coming back into work. But it would be good for us within gastroenterology to have additional and supplemental support to work schemes. So having keeping in touch days where we allow clinical skills to be maintained, particularly I think women coming back after a period of work would be concerned about picking up their endoscopy skills. So this is where we could have simulation days as well. And it's not just the technical factors, it's also the non-technical skills, particularly if you have a deteriorating patient. So that would be useful. Having clinical update days where we can just give an update of all the latest developments within the field of gastroenterology in the last 2 years. So talking through key landmark studies, papers, or clinical guidelines that have developed recently. It's very important for women to not feel under pressure to, on their first day, be on call or deal with very challenging scenarios. So it's important to have a graded reintroduction to the working hours. And allowing and encouraging opportunities for flexible working less than full time, and making sure that rota managers enable this and not make this a barrier. This does need to be the new norm of working. And it's important for successful reintroduction into clinical work is to have a mentor, and for the mentee to have frequent meetings with them to ensure things are going in the right direction, to manage their expectations, encourage self-advocacy, and offer any solutions to barriers that they come across. And it's really important that we have a culture change. I think historically, there is this perception that a successful career in gastroenterology requires working full-time, working antisocial hours, and almost working like a childless doctor. But actually, the new definition of success in gastroenterology should be having doctors who can work flexibly, combining their careers with their family commitments. That should be the new definition of success.